An abdominal aortic aneurysm. It's an enlarged area in the lower part of the aorta, the major blood vessels that supplies blood to the body. The aorta, about the thickness of a garden hose, runs from your heart to the center of your chest and abdomen. Because the aorta is the body's main supplier of blood, a ruptured abdominal aortic aneurysm can cause life-threatening bleeding. Depending on the size and the rate at which your abdominal aortic aneurysm is growing, treatment may vary from watchful waiting to emergency surgery. Once an abdominal aortic aneurysm is found, doctor will closely monitor it so that the surgery can be planned if it's necessary. Emergency surgery for a ruptured abdominal aortic aneurysm can be risky. Abdominal aortic aneurysm often grow slowly and usually without symptoms, making them difficult to detect. Some aneurysms will never rupture. Many start small and stay small, although many expand over time. Others expand quickly. Predicting how fast an abdominal aortic aneurysm may enlarge is difficult. As an abdominal aortic aneurysm enlarges, some people may notice pulsating feeling near the navel, deep constant pain in your abdomen and on your side of your abdomen, and also people may feel back pain. Most aortic aneurysms occurs in the part of your aorta that's in your abdomen. Although the exact cause of abdominal aortic aneurysms is unknown, a number of factors may play a role, including tobacco use. Cigarette smoking and other forms of tobacco use appear to increase your risk of aortic aneurysms. In addition to damaging effects that smoking causes directly to the arteries, smoking contributes to the buildup of fatty plaques in your arteries and other high blood pressure. Smoking can also cause your aneurysm to grow faster by further damaging your aorta. Next is hardening of the arteries. Atherosclerosis occurs when fat and other substances build up on the lining of their blood vessels, increasing the risk of an aneurysm. Next is infection in the aorta. In rare cases, abdominal aortic aneurysm may be caused by an infection or inflammation that weakens a section of the aortic wall. There are 5 risk factors of abdominal aortic aneurysm. This risk factor includes: number 1 is age. Abdominal aortic aneurysms occur most often in people 65 and above. Number 2 is tobacco use. Tobacco use is a strong risk factor for development of an abdominal aortic aneurysm. The longer you've smoked or chewed tobacco, the greater risk you have. Number 3 is atherosclerosis. Atherosclerosis, the buildup of fat and other substances that can damage the lining of the blood vessels, increasing your risk of an aneurysm. Number 4 is being a male. Men develop abdominal aortic aneurysm much more often than women do. Number 5 is family history. People who have family history of abdominal aortic aneurysm are increased risk of having the condition. People who have a family history of aneurysm tend to develop aneurysm at a younger age and are at the highest risk of rupture. Tears in the walls of the aorta are the main complications of abdominal aortic aneurysm. A ruptured aortic aneurysm can lead to life-threatening internal bleeding. In general, the larger the aneurysm, the greater the risk of rupture. Signs and symptoms that your aortic aneurysm has burst include sudden, intense, and persistent abdominal or back pain, pain that radiates to your back or legs, sweatiness, clamminess, dizziness, nausea, vomiting, low blood pressure, fast pulse, loss of consciousness, and shortness of breath. Another complication of aortic aneurysm is the risk of blood clots. Small blood clots can develop in area of the aortic aneurysm. If a blood clot breaks loose from the inside wall of an aneurysm and blocks a blood vessels anywhere in your body, it can cause pain or block the blood flow to your legs, toes, kidneys, or abdominal organs. Here are the general guidelines for treating abdominal aortic aneurysm. For small aneurysm, if you have a small abdominal aortic aneurysm about 1.6 inches or 4 centimeters in diameter or smaller and you have no symptoms, your doctor may suggest a watch and wait observation approach rather than surgery. In general, surgery isn't needed for small aneurysms because the risk of surgery likely outweighs the risk of rupture. If you choose this approach, your doctor will monitor your aneurysm with periodic ultrasounds, usually every 6 to 12 months, and encourage you to report immediately if you start having abdominal tenderness or back pain. For medium aneurysm, a medium aneurysm measures between 1.6 and 2.1 inches or 4 and 5.3 centimeters. It's less clear how the risk of surgery versus waiting stack up in the cause of medium-sized abdominal aortic aneurysm. You'll need to discuss the benefits and risks of waiting versus surgery and make a decision with your doctor. If you choose watchful waiting, you'll need to have an ultrasound every 6 to 12 months to monitor your aneurysm. For large, fast-growing or leaking aneurysm, if you have an aneurysm that is larger than 2.2 inches or 5.6 cm, or growing rapidly, grows more than 0.5 cm in 6 months, you probably need surgery. In addition, a leaking tender or painful aneurysm requires treatment. There are two types of surgery for abdominal aortic aneurysm. Number 1 is open abdominal surgery. To repair an abdominal aortic aneurysm involves removing the damaged section of the aorta and replacing it with a synthetic tube which is sewn into place through an open abdominal approach. Number 2 is endovascular surgery. It is less invasive procedure sometimes used to repair an aneurysm. Doctor attach a synthetic graft to the end of a thin tube catheter that's inserted to an artery in your leg and threaded up into your aorta. The best approach to prevent an aortic aneurysm is to keep your blood vessels as healthy as possible. That means taking of these steps. Number 1 is quit smoking or chewing tobacco. Number 2, keep your blood pressure under control. Number 3, get regular exercise. Number 4, reduce cholesterol and fat in your diet. If you have some risk factors of aortic aneurysm, talk to your doctor and your doctor may recommend additional measures including medication to lower your blood pressure and relieve stress on weakened arteries.